Health because the Parliamentary Ad Hoc Committee investigating circumstances leading to the death of a pregnant woman while in transit because her husband could not pay 600 cedis demanded by the ambulance service is asking the Health Ministry to review upward the allocation to the service or faces wrath. The committee is demanding timely releases of the 10 million cedis allocated for the operations. Chief Executive of the Ambulance Service, Professor Ahmed Nuhu Zakaria, says the timely release of funds is forcing personnel to demand money before transporting emergency cases. Listen to Jafar Mustafa, who lost his brother in the northern region in similar circumstances.
On the 12th of June, my brother had an accident, and then the case was very bad. So when we rushed into the Damango Teaching Hospital, they told us to buy fuel so that they could move him from the hospital there to the teaching hospital. So we had no choice than to raise that amount because we needed him to stay alive. So I had to contact my uncle, Mr. Gerard, before we could raise that money because at that instance we didn't have that money on us to pay for the fuel.
The ad hoc committee concluded its public hearings on Monday and is expected to present its findings and recommendations to the House tomorrow. Chairman of the Health Committee, Dr. Nana Eyu Efriye, says they have made a case for the adjustment of allocation to the ambulance service.
And it is purely not right. We don't have to encourage it. In fact, it has to be condemned. We must find solutions through policy. As a people, you must pay a little more to enjoy such services in terms of emergency. Look, going forward, the NHIA formula allocation to ambulance service to take care of fueling. We want you to up it. And if you don't up it, we will find means to frustrate you towards approval of the budget target. And I asked the Ministry of Health, should we strike a deal so that there's a trade-off? And they also agreed that it is emergent and they are going to make sure that there is going to be provision in that will increase them from the 10 million. And actually, I've called Professor for a meeting. I sent him a text yesterday, and he's waiting to have a meeting with us so that we can commence modalities, okay? And nonetheless, if there's going to be some reserve fund somewhere, okay, some other means to which we can be able to shore their funds up.
But Member of Parliament for South Dine in the Volta region, Roxanne Nelson Dafiametro, says the ambulance service has no right to demand money before transporting emergency cases.
We have a parliamentary enactment governing the operations of the National Ambulance Service, which is the National Ambulance Act 2020, Act 1041. Section 26 speaks of the funds of the service. Money is given by Parliament. They're also supposed to get money from the National Insurance Commission from the sale of stickers, that is right, roadworthy stickers and insurance stickers. Then they're also supposed to get money from NHIA formula. They're also supposed to get money from donations. And again, they are supposed to get money from the Minister of Finance annually. This year, Parliament approved some amount of money under the budget of the Minister of Health.
What happened?
So when they're interrogating and investigating this particular complaint, I was hoping that they would have recourse to the law to look at what exactly is happening. Under Section 33 of the law, it is an offense for anybody to charge fees from the public. Any public, no, it's an offense. So if there are budgetary constraints, you raise the matter.
Southern MP Roxanne Nelson Dafiametro Joy News has cited a copy of a petition by the Emergency Medical Technician Association of Ghana to the President highlighting major challenges with their services. Elton Bobe joins me with extract of that petition. Elton, what are the issues they face?
So part of it reads that there have been several instances across the country where, due to the lack of fuel coupons, our members requested for fuel support from the relatives to enable them transport patients to the referring facilities, which was misconstrued by the relatives because of the public have been made to understand that services of the National Ambulance Service is free of charge. Our members will be very happy to continue to render hassle-free emergency ambulance services to the public if certain measures will be put in place by your high office. And they say that they want regular flow of fuel as well as fuel coupons to enable the service to have enough resources to provide reliable services. Also, sanctions and authorize the service to issue receipts for the collection of fuel coupons. So these are the matters that they put before the health minister and the president. Key on it is availability of fuel for enable them work.
Elton Bobe there bringing us details of that statement by the Emergency Medical Technicians Association of Ghana.